Today we're going to talk to you, all you 40-year-olds and above, maybe even some of you 50-year-olds, on some exercises that you can do to save your back spasm, maybe even some 20-year-olds. Who knows, this could help out anybody when we are dealing with some type of back spasm. Now, one of the things that I do immediately when it comes to a back spasm, I was deadlifting, this was like, man, 3-4 years ago, I think it was, and I was deadlifting and I felt that strain in my lower back. I was in the gym. The first thing I did was I just got down on my knees and I just held myself there. Now, a lot of people get scared about those feelings and they go, oh my gosh, my back is, it's done, it's over, I can't move. But most times people go right into a stretching routine. They try to get themselves to relieve that spasm. That spasm is there for a reason, and the reason why it is there is trying to protect an area that you just injured. And so when we try to release that, it might actually be adding more into the problem because you create this false sense of security, and then all of a sudden your back starts to hurt even more, and then it takes longer for it to heal. So the first thing I do, if you guys are in back pain, if you have some type of spasm, again, this is not for everybody across the board. There's so many factors that may be playing into back pain other than just what we said before, a biomechanical issue, which is just a movement issue. But in this case, we're gonna try to relieve as much pain as possible. So the first thing we're gonna do is get you guys on your knees. Drop down on your knees and try to sit straight up. Some people are just gonna be like this for the first 5 minutes or so because you're in pain. The goal here is to slowly pick yourself into a position to where you're kneeling down with as little support as possible. You're gonna be utilizing your bed, you're gonna be utilizing a chair, desk, whatever it is, and you're gonna try to sit in front of that, and you're just gonna set your knees. I don't know if you could see because I'm wearing all black here, but my knees are about shoulder width apart from each other, and I'm holding on to something. Now, step number one is you're just trying to push your hips forward. You're just trying to sit up straight. You're gonna feel a little bit of a stretch on your hips. The main thing though is you guys shouldn't be feeling a pinch or lower back pain. You should be feeling all the pressure and work going into your legs because you're trying to get the legs to really help your lower back. You're trying to get them to take the load off of the spasm and the pain. And as you're sitting here, you're gonna sit up nice and straight. Once you get to that straight position, step number two is you're gonna have your hands here, but you're gonna work on trying to lift your rib cage up, right? We talk about breathing patterns here, but in this case, instead of working on flexing your core, you're working on trying to lift your ribs off of that spasm. So rather than stretching it out and doing all these twists and turns, you're just trying to work in this position where you're relieving some pressure off of those spinal, the discs, the joints, and the muscles. And so as I'm here, step number three now is gonna be slowly kicking my butt backwards as I walk my hands forward. And as I'm here, I'm thinking still, rib cage is up high, my butt is back, and I'm trying to lift my mid-thoracic, my mid-back, my rib cage off of my lower back as I'm pushing my hips back. Now, as I'm pushing my hips back, I'm almost separating the lumbar spine because my ribs are going up and my butt is going back, and I'm pushing them away from each other to not stretch, but just decompress the discs probably that are irritated and the joints that are irritated in that area. I'm trying to get blood flow going. I'm trying to isolate, doing isometric exercises to decrease pain because isometrics and movement have shown to decrease pain patterns. And if we do that and we work away from the pain, remember, you shouldn't be in pain when you're doing these exercises. If you are, these exercises are not good for you. So you're pushing your butt back, you're trying to lift that rib cage off of yourself, and you're just trying to work on breathing here, all right? That's step number three. Step number four, now that you've gotten into that position here, now we're gonna try to get the whole back to work on an isometric exercise. So John, you wanna teach me how to do it?
Sure. So what we're gonna have Dr. Joe is, you could do this on home on a chair or actually on a bed is probably better so that you could lay your whole upper thoracic area flat. And all we're gonna have Dr. Joe do is what we call hip extension, which is to activate the hips and the hamstrings and the lower part of your leg. And once he lifts his leg up like this, depending on where you're at with your pain,
Your tolerance, yep.
your pain tolerance, You bring it up to a point where you feel this contraction and hold it there for a few seconds and then release it.
Pain-free.
Back down. Pain-free is key, all right? All he's doing is lifting it up. And you may feel like, oh, wait, what about I feel my lower back? Well, you're going to feel a little bit because obviously that area is tender and sensitive, but you should focus on the hips, the hamstrings, even on the lower leg as far as lifting up that area right there, okay? And you will soon enough feel less stress in the lower back because the lower part of your body is taking a lot of that stress off of this area, okay? And same thing, you want to breathe, okay? Belly breathing. When you come up, take it to the top, exhale, and then inhale as you come in, inflate that belly. And that breathing pattern is going to help also relieve some of that stress off of the muscles of the lower back area, right? Cool.
Remember, the key word here, guys, is pain-free. We do not want to be working into pain as we do these exercises. If you can't even get to a kneeling position and it hurts you, stop. Stop what you're doing and try to get into something else. Try to get into another movement. Pain, sometimes, yes, rest might be the way to go, depending on what your lifestyle factors, what kind of lifestyle factors play into your environment, right? So there's so many different ways that we could treat low back pain and so many ways that we can get you better, but this might just get you to where you need to be in order to get you moving again.